Today we have with us Rosemary Stutzka, who is an LPN for Seasons Hospice. Rosemary, would you go ahead and introduce yourself, talk about where you work, what you do, and why?
I'm Rosemary. I work for Seasons Hospice as a resource nurse. I am an LPN. I work in the office as the resource, which includes helping with a lot of the prep work for admissions. I help with, I help the RNs with the support they need when it comes to the patients that they have. I'm just the go-to nurse. I answer phones for patients when the other nurses aren't available. I kind of just do a whole bunch of other things. What I like about Seasons Hospice is we're just a really good team. We help support each other. We care for the patients, and it's really a patient-centered company, and I really enjoy that.
Sounds like a lot of teamwork is necessary for the kind of job that you do.
Very much so.
Rosemary, can you tell me about what it is like being a nurse or an LPN in hospice care?
It's trying to think of the word. It's amazing. It's heartbreaking. It's phenomenal. It's heartwarming. It's so many different things all at the same time. It's the best thing that I could do.
If I were to go into hospice care as a nurse, what kinds of things would I expect to be different than, say, working at a hospital or in a clinic or in an assisted care living facility?
Yeah, that's a great question. So one of our main focus in hospice is the comfort care, to keep our patients comfortable the last days, months, weeks of their life, and we just really focus on comfort and quality instead of healing and promoting and treating. So we get to just have good days and fun times.
So as a resource nurse, you are supporting LPNs and RNs that are working with the patient directly, right?
Mm-hmm.
So
yes.
What kind of knowledge and skills do you need in the office to help them in the field?
Medications is a big one. End of life symptom management, pain management. I help write a lot of orders for the doctors and providers, and I get to fax. So I get to know how to run a fax machine.
It sounds like you know exactly what they need in the field. How do you know that so well?
Time. I also used to be the LPN in the field. So having the experience working in the field with the patients and knowing what, as a nurse in the field, what I needed, and now being in the office, being on the other end, being able to help support them, I already know what they need.
Sounds really amazing. Rosemary, what kinds of classes in high school would you say have really helped you prepare for doing the role that you're doing now?
You know that one math problem that you said you would never need to know how to do? You know, you need to know how to do it as a nurse, which is really ridiculous to say now that I've gone to college and learned everything. I wish I would have paid more attention in high school math. The other one is English. You would be surprised at how nice and neat the providers want your communication, and they correct your grammar.
Can you talk, because I come from a math ed background, I love math. Can you tell us about this math problem that you encountered at work?
A lot of medications come in, like, they come in tablet or liquid form, and then they come in milligrams. So you need to be able to convert the dosing into liquid form. But the liquid form comes in a specific ratio. So then you have to be able to do the conversion from ratios into milligrams.
Awesome. So it sounds like the basic reading, writing, math is the core classes are really helpful to you now in your job.
Yeah.
Awesome. Would you tell me about your path? How did you decide to become a nurse and some of the education or training you needed in order to get there?
Yeah, so I actually went to school to be a cosmetologist, and I did that for about 7 years and decided to go back to school for nursing. I wanted to help people, and once I finished schooling for LPN, I went the hospice way, which is helping, just not in the healing portion. So that was kind of ironic when I look back to think about helping people. I just helped them die a peaceful way. So in terms of training, there's the core classes for LPN. Prior to that, there's English and math that you have to take, the prerequisites to get into LPN school.
Once you got into your job at Seasons Hospice as an LPN in the facility, in the field, did you have to do some sort of training, like on the job type training at all?
Mm-hmm. Yep, but I think that's typical for any job, just your typical, this is how we do it, this is how our program works, this is how our electronic system works. We also have, there's a couple of apps I have on my phone I can write orders and scripts through my phone. I can order medications through my phone. We have a HIPAA approved like text message program. So it's really, I can do a lot of my job through my phone.
That sounds pretty slick.
It is pretty cool.
What are some different career opportunities that you've seen or that are available at where you work?
So at Seasons Hospice, we have a hospice house where we can have 8 residents live. So we have what we call home care, where we travel to our patients' residence of living, and then we have the hospice house. So we can work in home, there's opportunities to work within home care, and there's opportunities within the house. We also have CNAs that work here. We have LPNs, RNs, social workers. We have massage therapists, music therapists, chaplains. We have pet therapy. Those are our volunteers. And then office staff. So there's quite a variety of staff that keep our organization running, but there's also room for growth. If I were to go back to school to become an RN, I can stay within our company because there is higher positions.
Awesome. Does your company help you if you did want to grow and get more training education? Do they invest in you in that way at all?
Yes, we do. There is an allotment for continuing education. I don't remember how much that is, but there's a certain amount we get every year, so that I can use that to better my knowledge as an LPN, to get specific certifications, or I can use that to go back to school for my RN.
Awesome. How else does your company invest in you as an employee?
They have a pretty good 401k, I will admit myself. And their PTO, I cannot complain about their PTO. They're really flexible with scheduling and needing time off. They're just, it's a small company, but there's a lot of employees, but it's a very nice company, and they know all of their employees, and I can go to them when I need something.
Sounds like a tight-knit family.
It kind of is.
Awesome. Rosemary, if a student in high school wanted to learn more about what you do or being an LPN, how could they contact you?
The best mode of communication with me would be email right now. I have access to that all the time.
Cool. What else do you think students should know about your type of work or your company?
My type of work is super rewarding. That would be my job summed up, is just rewarding and fulfilling. And being able to do it with a team of others who have a really big heart and just want to be present with their patients.
One last question for you.
Yes.
What would you tell your 18-year-old self about career exploration?
I would tell my 18-year-old self to go to nursing school, because that's what I wanted to do when I was 18, and I chickened out. So I would tell myself that you're smart enough and you're worth it to go for what you want. So go ahead and go for it. Don't hold back, because you can do it.
That is some great words of advice. Thank you so much for joining us today.
No problem.